Hi, my name is Shazana Nabila from Bachelor of Physiotherapy, Cohort 20. So today I would like to present a cranial nerve assessment from cranial nerve 1 to cranial nerve 6. Okay, first we're going to look at what is the cranial nerves. It is a 12 pairs of nerves lead directly from brain to various parts of head, neck, and trunk, named and numbered based on their location, and relay information between brain and parts of the body. So, as you can see in the picture, is the list of 12 pairs of nerves, cranial nerves, with their locations. Now here, as you can see, is the cranial nerve innervation for each different nerves with different locations. For olfactory, is the first CNS is for sensory nose, optic, sensory eyes, oculomotor for motor, all eye muscles, except those supplied by the fourth and the sixth cranial nerves. Trochlea for motor, specific to the superior oblique muscles. Abducen, also for motor, external rectus muscles. And the fifth trigeminal is sensory for the face, sinuses, teeth, and etc. And for motor is for muscles of mastication, which is for chewing. Okay, next. Okay, we're going to look at the first cranial nerve, which is olfactory. The sensory function is to smell, or also called as olfaction. Examination that we should done is to test the sense of smell by closing the other nostril and using non-irritating odors, such as you can use essential oils and coffee scents, mint, and lemon. This test is involved for inability to detect smells, which is called anosmia, which shows a lesion on temporal lobe. Let's see the examination procedure.
The patient is in standing or sitting position and is asked to close the eyes and to keep them shut. One nostril is held shut as each nostril is tested separately. Hold the opened alcohol pad under the patient's nose at a couple centimeters distance and ask them to identify the smell. Repeat the same process with the other nostril.
The next examination is for the second central nerve, which is for optic. It's a sensory function for vision. The examination taken is to test visual acuity using Snellen chart, which is the letter EFPS is decreasing in size, and test central and peripheral vision. And this test involve in blindness, impaired vision. For far is called myopia, and near is presbyopia. As you can see here, the focal point is either in front of the retina or back of the retina, which is not on the exact point to perform the image. Let's see how the examination is done.
The patient stands 3 or 6 meters away from the chart depending on which one is used. Each eye is tested individually, so the patient covers their other eye with their hand. If they use glasses or contact lenses, these should be worn during testing. They then read the letters on the chart out aloud.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D.
In case uncontrolled acuity is less than 20/20 or 6/6 vision, you can use a pinhole test, where the patient reads through a 2mm pinhole in a piece of cardboard or a special device. Other ways include testing the visual quadrants. For example, with the patient in sitting position in front of you, ask them to look you in the eyes. Then place the fingers in all quadrants at around 60 degrees from the meridian. Then ask the patient to indicate which fingers are wiggling. Furthermore, you can move from the periphery diagonally to the midline and ask the patient to respond once the fingers appear in their visual field.
No. No.
The next examination is for both the second and the third cranial nerve, which is for optic and oculomotor. which is have somatic motor function, which is eye movement and elevate eyelid, as in open and close your eyes. Autonomic function, which is constricts the pupil and accommodate the eye for near vision. The examination is by test the pupil quality, size, and shape. The second test is to test the pupil constriction by shining a light in the eye. These tests involve the absence of pupil constriction. We can also see if there is unequal pupils, which is called anisocoria, or Honest syndrome, and cranial nerve 3 paralysis. So now let's see how the examination done.
To test the reflex function, ask the patient to make a shield between their eyes with one hand. Then use a flashlight to shine light into the pupil and observe for the narrowing of the patient's pupils in both eyes. Check for a direct and consensual reflex. Compare this with the other eye. Optic nerve damage would result in no reflex contraction of the pupils upon shining the light in the affected eye. Illuminating the other eye results in a normal response. Of course, the lights in the room should be dim.
The fourth examination is for the third, the fourth, and the sixth cranial nerve, which is oculomotor, trochlear, and abducens. The function for the trochlear nerve is somatic motor function, which is eye movement and elevate eyelid. And the sixth cranial nerve, abducens, is for somatic motor function as well, to abduct the eye, which is to the side. So the examination is test extraocular movement, and then we observe eye position, presence of strabismus, which is called loss of ocular alignment, or ptosis, which is droopy of eyelid. The other eye is droopy. Next, test pursue eye movement without head movement. Can they change the eyelid movement without moving their head? These tests involve strabismus and impaired eye movement. For cranial nerve 3, they can happen ptosis or pupil dilation. For cranial nerve 4, eye cannot look down when abducted. For cranial nerve 6, eye pulled inward and eye cannot look out. They cannot look at sideways. They only can look toward the inward. So let's see how the procedure is taken.
Examination starts with the pupils. Inspect the size, shape, and symmetry of the pupils. The papillary light reflex is elicited by shining a light into the eyes and assesses the oculomotor nerve, which innervates the sphincter papillae muscle constricting the pupil. Shining a light into one eye should result in constricting of that eye's pupil, called the direct response, as well as constriction of the other pupil, called the indirect response. Damage to the oculomotor nerve results in absence of the light reflex. Next, assess the accommodation reflex. The patient is asked to first look into the distance and then focus on the tip of their nose in the second step. Here, the pupil should also constrict. Eye movements in each direction can be assessed in 6 steps. Without moving the head, the patient is asked to gaze upward and to the right, then upward and to the left, horizontally to the right, horizontally to the left, downward and to the right, and downward and to the left. Alternatively, ask the patient to follow a head pin or pen in an H pattern. Ask the patient if they experience double vision and check for failure of movement.
Now for the next examination is for cranial nerve 5 for trigeminal nerves. Its sensory function is to conduct touch, temperature, and pain sensation from the face, nose, mouth, nasal, oral mucosa, anterior 2/3 of tongue, and anterior scalp, which is around here, part of auricle of the ear. For somatic motor function, it innervates the muscles of mastication, chewing, mylohyoid, gastric, which is the anterior belly, tensor belli palatini, and tensor tympani. The examination done is by pin and light touch sensation of face. You can swab it on the forehead, on cheeks, and jaws. Test corneal and jaw jerk reflex will be shown later. open and close jaw against resistance. The involvement of this test is to loss of facial sensation and numbness. We want to see if there is any loss. We also want to see if there is a loss of ipsilateral corneal reflex, which is one might dilate with the shining light, but the other one might not. Weakness and wasting of mastication muscles, jaw deviation when open to ipsilateral side. So now let's see the examination.
To test the sensory innervation, a cotton wool ball and blunt pin are used. The patient is asked to close their eyes. Then the cotton ball and pin sequentially touch the forehead, the malar eminence, and the lower face over the mandible. The patient is asked to state when they feel the touch and whether they feel a sharp or dull sensation. Both sides are compared.
Dull, sharp, dull, dull, sharp, dull, sharp, sharp, dull, sharp, sharp, dull.
Another item to test is the corneal reflex. Stand to the side of the patient and depress the patient's eyelid. Ask the patient to gaze into the distance. Then, using a wisp of cotton, touch the cornea gently. Observe for a blinking reflex in both eyes and ask the patient if they felt the touch. To test the motor function of the mandibular division, ask the patient to clench the jaw while you palpate for muscle tone and muscle bulk. You can also ask the patient to hold the mouth open while you try to force it shut with your hand. At last, examine for an exaggerated jaw reflex. With the mouth slightly opened, place one index finger on the chin and tap it with a reflex hammer. Normally, you would observe slight closure or no reflex at all.
That is all for me for cranial nerve assessment from cranial 1 to 6. Thank you for watching.